As hospitalizations from COVID have skyrocketed up 300% in less than 3 weeks, many El Pasoans have begun to get tested more frequently. From the EP Strong website, we can see how much testing has increased this month compared to our first wave in July. We can also acknowledge how it has caused the test results rate to slow down due to the amount of tests being done daily. With this comes the question, which COVID test is the most effective?
There are three different kind of testing that is being done these days. Is like I mentioned, the RT-PCR, which is the gold standard, and it's very specific and accurate. And then we have a second one that is called the antigen test. And this antigen test, what it is testing, it's proteins from the virus.
The test most commonly used in testing sites is the nasal or mouth swab test, which is the RT-PCR test. This test usually takes 3 to 5 days to determine the results, compared to the antibody test that takes 1 to 3 days, or the antigen test that takes 30 minutes.
The RT-PCR test detects nucleic acid, or in other words, detects directly the virus. And it's the most specific and sensitive test. It is the best.
But the antibody, or better known as the blood test, is also important, as it can let people know if they have the antibodies to combat COVID. This is why health officials are urging people to donate their plasma.
Certainly, the higher the antibodies, the better we think that the antibodies, these proteins that are found in plasma, can be utilized and given to the infected patients to see if that'll help stimulate their immune system to fight off the infection. The other factor is how long do our antibodies last? How long will they prevent us from getting reinfected? And unfortunately, just like a lot of things with this virus, we're not sure. We don't know how long that immunity lasts. We think 2 to 3 months, but we cannot be totally sure about how long it lasts.
This is why it is important to keep testing frequently, keep social distancing, and follow the stay-at-home orders, while researchers work on a better test and a vaccine.
There are several tests coming out, and we're not sure what their false negativity rate is yet. That may be better and quicker than the PCR that we're using right now, but we just don't know what. They're not out yet in mass production.
For more information on times and testing sites at UTEP, visit utep.edu/COVID testing. Noelia Gonzalez, reporting for The Prospector.